Hi, my name is Dr. Geeta Yadav. I'm a dermatologist and founder of Facet Dermatology. Today we're going to talk about neurotoxins. So you may have heard of Botox or Xeomin, Dysport. These are lab-purified neurotoxins that are used to prevent muscle contraction. And we use these medications in both a medical as well as a cosmetic setting. Today what we're going to do is show you some examples of how it's used in a cosmetic setting primarily. So how do these medications work? Well, they stop the signal going from the nerve to the muscle, therefore stopping the contraction. As we age, those contractions in the muscle are what cause wrinkles, like a fold in paper. If you are on the younger end, maybe in the 30s or 40s, using those neurotoxins can actually smooth out the wrinkles entirely. As we get older, those wrinkles may not be as deep by using treatment, but sometimes it will still be visible, even after being treated. Neurotoxins work by reducing muscle activity in the injected area. Today I'm going to show you how I inject neurotoxins into 6 areas that I commonly treat. The first is the frontalis. Forehead lines or rows are one of the 3 most commonly treated areas. Lines in this area are often formed by making the expressions of surprise. I inject neurotoxin very superficially to stop this muscle from wrinkling upwards. This muscle is the brow elevator, so you have to be careful not to inject too low, otherwise people may feel that their forehead is heavy after a treatment. The next area I'd like to show you is the glabella. The glabella, or is the area between your brows, is a common area for lines that crop up. People often call them the 11s or frown lines because they're formed by scowling. When I inject this area, I'm trying to target the big muscle in the middle, that's the procerus, as well as the long muscles that pull the brow inwards. Those are called the corrugators. Sometimes I inject the lateral eyebrow to give people a bit of a lift so that their eyes look more bright and open. The nasolabial folds is the next area we're going to treat. The nasolabial folds form from smiling. While this area can also be treated with filler to plump up the creases or high up in the mid-face to kind of pull the face backwards and upwards with extra volume, you can also relax the muscle that creates the fold. Try to make a snarling face. That muscle next to the nose is the one that creates the nasolabial fold. I inject a few units laterally and inferiorly to that point in the corner where your nose meets your cheek. This should only be injected by a skilled provider because you can cause asymmetry in a smile by injecting incorrectly. Crow's feet are the lines around the eyes. These are also known as smile lines because they can fan out from the inner corner of the eye and often appear more visible when a person smiles. They can look a bit like a bird's foot, hence the name crow's feet. These lines are created by squinting as well. In order to treat this area, it's important to inject, again, superficially small quantities around the orbicularis oculi muscle at the lateral end. I also sometimes use a microtox technique, injecting further out to help minimize the radiation of these lines outwards. You can get a much softer look by doing it this way. Bunny lines. These lines are caused by scrunching your nose, which many people do when they smile. By relaxing the muscles around the nose, these lines will be less prominent. Again, this area requires precise injection to the superficial muscle on either side of the nose. It should only be injected by a skilled provider. The mentalis. Over time, the chin can start to take on a pitted or dimpled look. By injecting the underlying muscle, known as the mentalis, you can smooth out the appearance of the chin. This typically requires an injection point on either side of the chin to target both aspects of this muscle. This area should only be injected by a skilled provider because if it is done incorrectly, one can experience a bit of droop in the smile. Patients often ask me how long their toxin is going to last. I explain that the data shows, and it's the label on the bottle, that it will last about 3 months. Sometimes you can get 4 months out of it, sometimes it's dose dependent, sometimes it's location dependent. When I treat lines around the lips, for example, that typically wears off a lot more quickly than lines around the eyes. Again, getting the right recipe for the patient is the most important thing, and I ask my patients to come back to the clinic within 2 weeks of their first treatment so I can see how everything is settled in and make sure that that peak effect is just perfect.